Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in the Going Deep segment, brought to you by CO2Lift in our Expert on the Microphone series. Today we're featuring Dr. Kian Karimi. He's a world-renowned, double board-certified facial plastic surgeon and head and neck surgeon. He maintains a thriving medical practice, Rejuva Medical Aesthetics in Los Angeles, that focuses on advanced facial plastic and reconstructive surgery, head and neck surgery, and endonasal skull-based surgery, as well as non-invasive procedures. He's gained trust and built his reputation by serving individuals from all walks of life with the utmost care. Patients include A-list celebrities, high-profile executives, and public figures, professionals, athletes, trauma victims, and even young adults. He's going to join me now to chat all about the rising popularity of, you guessed it, non-invasive procedures. That's what I like to talk about, and how CO2 Lift is improving treatment results and patient comfort. Welcoming now to the show is the amazing Dr. Karimi. Welcome to the show, superstar.
Thank you so much, Zen. I'm so happy to be here. I'm a big fan of you and the show, and I've seen some other segments, and I'm really excited to be here.
I'm so excited to have you on. Let's dive deep. So you have had quite an impressive career, my friend, already, from graduating medical school at 23 years old with the Alpha Omega Alpha Award. Hello, recognizing the top 10% of students nationwide. That's impressive. To now founding your own practice and being considered one of the nation's top facial plastic surgeons. Now, I'd love to know what inspired you to enter this field and specialize in both facial plastic surgery and head and neck surgery, which is not very common.
I've always been bored very easily. And so when I was younger, I just wanted to take as many classes as I could, learn as much as I could. And I just always had this drive to be around brilliant people, be challenged. And I've always loved a challenge, which is why after I finished all my training, I moved to Los Angeles with no job. I had no connections, no family, nothing. And so that's really where, even though I was a fully trained facial plastic surgeon, I had to start my career in the minimally invasive and non-invasive. And that's kind of now we're back full circle. Even though I have a thriving surgical practice, the demand and awareness now in aesthetics compared to 14 years ago when I started my practice is absolutely incredible in terms of what is different, what is new, and how much the consumer now knows about aesthetic treatments.
It's incredible. And that's really the hardest part, right? It's not hard, but it's also it's very rewarding for you to be able to speak to an educated patient. And I know you're also recognized as a pioneer. Now we're going to talk about specifically my favorite topic of these non-invasive procedures. And personally, you train surgeons across the nation on the best practices of PDO thread techniques, microcannula filler injections, and even utilizing autologous blood plasma for aesthetic and reconstructive purposes. I mean, what don't you do? And this is quite impressive. Recently, guys, I read you've actually been seeing a shift, and this is funny because you said it at the beginning, towards patients' preferences now that we're coming full circle to these non-invasive procedures. So you said this, not me. So let's bring carboxytherapy into this mix. Now we all know that carboxytherapy has actually been around since the 1930s, but CO2 Lift was able to find a way to remodel this into a new delivery system as a non-invasive topical gel, which makes it so much more accessible and easy. Now, Dr. Karimi, in your expert opinion, what do you believe is driving this increase in demand for non-invasive procedures?
Surgery is a micro fraction of the actual aesthetic environment and of the market. And most people, the vast majority of people, want to know what is the latest and greatest in non-invasive or minimally invasive therapy. And this is basically from my trainings and from my own expo, the demand is there from the practitioners as well, because our patients are asking, what can I do to improve my skin, to improve my skin health, improve my aesthetics without undergoing the knife and without undergoing significant amounts of downtime. Now that we're post-COVID, we're all back to work, we're all back to our lives, and we don't have a lot of downtime. And so when I met Lana Kerr, who's the CEO of CO2Lift, and I first heard about it, I was like, okay, that sounds interesting, but you have to hear something a few times for it to really register. But then I finally took the time to sit down in a scientific advisory board with my peers, plastic surgeons, dermatologists, world experts in aesthetics, and I learned a little bit more about the science of carboxytherapy and the CO2 lift. Now I have fully embraced the technology in my surgical practice, in our non-surgical practice, and in our patients who are looking to maintain their aesthetic or get a really nice skin glow before an event in particular.
Okay, perfect. Now let's talk about this. So let's talk about a bit more about how CO2 lift works. Can you describe the application process and how CO2 lift functions on a cellular level?
Absolutely. So CO2 lift is carboxytherapy. And as you mentioned, Zen, this has been around, I believe it was discovered in Japan. And what it does is that it infuses CO2 or carbon dioxide into the skin and the subcutaneous tissues. This then, the tissues think that there's a lack of oxygen there. This is called the Bohr effect, Bohr, from a very famous physicist who described this. And so then the body, the skin says, oh my goodness, there's not enough oxygen here, and it rushes oxygen to this area. The vessels dilate, and the red blood cells give their oxygen to this area that thinks it's injured or that's lacking oxygen. So this is the kind of basis behind carboxytherapy, which then hyperoxygenates the area. This leads to improved blood flow, increased collagen, repair of the area, and an overall general improved health of that area.
It's fascinating, truly. I mean, CO2 lift, when you talk about non invasive, now we know that it's clinically proven. It's medical grade treatment, right, to help us achieve these med spa quality results in regard to hydration, elasticity, and essentially reverse the aging process, not to mention you can do it all in the comfort of your own home. That's what I love. But it's important to note that in addition to CO2 lift being used as a monotherapy, it could also be used in combo therapies, both pre and post procedure. That's what I want to hear more of. So when we talk about combo therapies, doctor, we're talking about CO2 Lift Pro, which is the strongest version and can only be provided to patients by medical professionals like yourself. So, what procedures do you use CO2 Lift Pro in conjunction with? And how have you firsthand seen it improve a procedure's results and a patient's comfort?
So we incorporate the CO2 Lift Pro now in almost all of our procedures in the office, which include microneedling with radio frequency. People may have heard of Morpheus, A treatments. We also incorporate it with laser treatments. So we have a lot of the different lasers that people have heard of, Moxie, Halo, but really any laser resurfacing treatment or anything that causes injury to the skin. If you think about it, then the body is undergoing injury. It's a controlled injury because we're trying to get a result. And so if you simulate increased oxygenation to this area with carboxytherapy, it makes a lot of sense. And when I sat in this advisory board that I talked about, there's actually multiple published studies looking at half the face treated after a laser with carboxytherapy and half of the face not treated. And it is incredible how much faster the side treated with carboxytherapy with the CO2 lift heals. So now I used to make it like an add-on, but now I've just built it into the procedures because I believe that it is so important and helpful for faster recovery, and everybody wants to recover fast after a treatment.
Without a doubt, recovery is at the forefront of, I think, most women's decision when it comes to a procedure, invasive or non invasive. Now, let's chat about skin pigmentation, specifically melasma. So, melasma affects approximately 5 million people in the United States, most commonly affecting women. And it's a skin condition resulting in patches and spots, usually on the face, which are darker than our natural skin tone. Now, there are many procedures that can be used to treat this, such as chemical peels and microneedling, broadband light therapy, or the halo laser, which deliver excellent results, but can result in added inflammation and downtime after the fact. So, talk to me about how CO2 lift can factor into this to both improve skin pigmentation and speed up the recovery process.
Absolutely. So melasma, as you mentioned, is a very difficult issue to treat, and it can be quite problematic for patients, particularly women who get pigment all over their face. They call it the mask of melasma. Melasma is a tricky beast. If you don't deal with it just right, it can worsen or it can come back, and it's really sensitive to heat, it's sensitive to sun, and hormones, and a lot of different factors. The CO2 lift really comes into play because it helps to decrease the inflammation of the area being treated, particularly of the area with melasma. So the CO2 lift can be used as a standalone to help kind of decrease the inflammation, improve blood flow to the area, or in conjunction with the treatments that we are using to treat melasma. So I do think that the CO2 lift is so important, particularly if a treatment is being done, because sometimes those treatments, as you mentioned, can actually worsen melasma. So the CO2 lift kind of gives you an insurance policy that you're going to be increasing oxygenation to the area, improving blood flow, bringing in all the healing and growth factors to that area being treated to really minimize worsening melasma, and more importantly, decreasing it and making the patient feel more confident.
It's fascinating. Now, you also specialize in rhinoplasties, so let's pivot a little bit, and you even have a whole Instagram page dedicated to this. What new technologies or techniques have you implemented in regard to rhinoplasties, and what does the typical recovery process look like? How do you help your patients really manage that post-surgical care?
I love rhinoplasty. It's actually the procedure that inspired me to become a facial plastic surgeon. It is the most complex procedure. It's considered to be the most difficult procedure. Like I told you, I like a challenge in all of plastic surgery. And even though our noses are in the centers of our face, the best rhinoplasties are the noses, in my opinion, that are not seen, that bring out the eyes, bring out the smile, and really help to harmonize someone's face. Rhinoplasty has been around for a long time, but there have been some important developments over the last several years, which have led to more precise rhinoplasty results, better control, and of course, less recovery and less downtime. Now, after an ultrasonic rhinoplasty or a nose tune procedure, which is what I call my approach to rhinoplasty, my patients can be back to work at a week. Cast comes off at 6 days. There's usually very little bruising and swelling. And these are because we have better tools now. We have ultrasonic devices that make precise carvings in bone rather than hammers and chisels. And this has really led to much better results and faster healing. Now, just getting back to the CO2 lift, one of the really incredible things that it can do is actually reduce bruising big time. And so if I do have a patient for whatever reason, 1 in 20 of my patients, 1 in 30 will have some bruising at the 1 week mark, we'll actually apply CO2 lift to the area and it lifts the bruising incredibly. When I do a face and neck lift procedures, typically there's very little bruising, but sometimes, especially men, will get a fair amount of bruising. So we immediately start applying CO2 lift, and it is amazing on how it improves bruising.
Game changer. Now, education is also extremely important for you and your colleagues, especially in an era of such rapid advancements. I know you're a co founder of the Los Angeles Multi Specialty Cosmetic Academy, and you have been a volunteer faculty at the UCLA and USC Schools of Medicine. So clearly, you're no stranger to the importance of education. But could you talk to me more about why being well educated on the latest trends and technologies, such as CO2 lift, is so crucial in the field of dermatology?
Absolutely. I mean, I travel almost every month to go to some meeting, some conference, because just like I shared with you about being around bright minds and being around innovators, our field is ever changing. I mean, every month, every quarter, there's something new out, or there's a new understanding of what we're doing. So that's why education is so important, especially in aesthetics. People don't realize how much we're learning every single month, basically, in terms of better understanding of what we're actually doing to patients, a better understanding of the products that people have been getting into their faces, whether it's injectables, threads, biostimulators, etc., and seeing this kind of really cool new technology like the CO2 lift. It was at a meeting that I heard and learned about the CO2 lift. And of course, it took me a little while to kind of come full circle. And now, actually, the CO2 lift is part of the LAMCA meeting that you mentioned, because I only like to showcase and highlight what I think is really relevant to our patients and is true innovation in the world of aesthetics.
I love the cheerleader in you. I really do. And more importantly, I love that you find these unique products, trends, and services to offer to your clients. And you're clearly at the forefront of all the technological advancements in your field. And I thank you so much for coming on, educating us, being transparent, and really guiding our audience in the right way when it comes to making these informed decisions for any level of invasive or non-invasive procedure.
Thank you so much, Zen. It was wonderful being on your show, and I really commend what you're doing in terms of educating your audience in terms of what is real and what is relevant in our world. So, thank you for doing that.
That was our Going Deep segment brought to you by CO2 Lift. And that was the incredible trailblazer, Dr. Kian Karimi, world renowned and double board certified facial plastic surgeon and head and neck surgeon. Definitely head to drkian.com and rejuvamedical.org to learn more. And of course, check him out on the gram at Dr. Kian. That's Kian, and Rejuva Medical Aesthetics. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to CO2lift.com.